Steven, you're the Secretary of Health and Human Services. Reclaiming my time, I'm asking about tangible actions and results. To me, the fact that you can't answer a basic question like bringing down cost and coverage, which should be your top priority, not some podcast, but actually addressing the needs of people. Now, like others, I want to make America healthy. I agree with the goal of moving from a sick care system to a true health care system focused on prevention. And prevention starts with the basics: clean air, clean water, and reducing
The man who runs the Department of Health and Human Services sat before a congressional committee and told a lie that millions of American families know is a lie. He looked at a representative of the people and claimed that Medicaid is not being cut. He claimed that drug prices are the lowest in history while citizens are choosing between food and medicine. He claimed that he has no role in protecting the water you drink from brain-damaging toxins. This was not a hearing. This was a demonstration of institutional collapse. We are going to look at the transcript of a secretary who does not coordinate with the agencies that affect your health and cannot explain why your premiums are rising by thousands of dollars. This is the evidence of a department that has abandoned its mandate. The Secretary of Health and Human Services, Robert F. Kennedy Jr., stood before the House and made a definitive statement about the safety net of this country. That statement was a lie. It was a categorical falsehood delivered under the weight of his office. He was asked directly about the survival of the American people. He responded by denying the reality of the policy he oversees. The specific lie occurred during an exchange with Representative Steven Horsford. When confronted with the fear and rising costs facing constituents, the Secretary stated exactly these words: "Congressman, there are no cuts to Medicaid." That is the claim. It is an absolute denial of the legislative and administrative reality of the current government. He did not say he was trying to prevent cuts. He did not say cuts were minimal. He said there are no cuts.
Well, first of all, I would say, Congressman, there are no cuts to Medicaid. You look at the congressional...
What are you doing, Mr. Secretary? That's my question is, what are you doing right now? What are your priorities to reduce cost and ensure coverage for the American people?
Well, we negotiated the lowest drug prices in history, and we're implementing those now with the MFN. This is one of many things that
And how does that address?
The evidence shows that without Medicaid, the costs would be inaccessible. The copays alone would be enough to leave this child at risk of failing to thrive. The Secretary's claim that there are no cuts is a direct contradiction to the real-life consequences and real fear these families are living with every day. They are seeing their access to care threatened by the very administration the Secretary serves. The second piece of evidence is the financial record of a constituent named Richard. At the beginning of this year, Richard saw his marketplace premiums increase by $1,700 per month. That is not a typo. That is a $1,700 monthly increase for a family trying to maintain coverage. Richard told his representative that he and his wife are now effectively out of the economy. They do not go to restaurants. They have no discretionary spending. They are spending every dollar they have just to make sure they have access to care.
And what I heard wasn't a matter of politics, but rather of survival. One of those constituents is Deja, a mother of a medically complex child, Shay. Shay was born at 30 weeks. He spent 3 months in the NICU and came home on an oxygen and feeding tube, one he still depends on to survive today. He needs in-home nursing, specialists, and ongoing care, all made possible by Medicaid. Without it, his family would face inaccessible costs and...
He coupled this with a secondary claim that his agency has negotiated the lowest drug prices in history. These are the twin pillars of a false narrative designed to mask a crisis of affordability and access. The forensic evidence tells a different story. Representative Horsford brought the evidence of 2 specific American lives to the floor. The first piece of evidence is the case of a constituent named Deja. She is the mother of a medically complex child. That child was born at 30 weeks and spent 3 months in the NICU. He went home on an oxygen and feeding tube. He still depends on that feeding tube to survive today. He requires in-home nursing specialists and ongoing care. All of this care is made possible by Medicaid.
I've also heard from another constituent, Richard, who told me that at the beginning of this year, his marketplace premiums went up $1,700 a month. He said he and his wife are effectively out of the economy. They don't go out. They don't get to go to restaurants. There's no discretionary spending because they're just trying to make sure that he has access to care. So families like Deja's and Richards, to them, the healthcare affordability crisis is real and it's urgent. So let me bring it back.
This evidence proves that the Secretary's claim of lower premiums is a statistical fiction for the people actually paying the bills. When the Secretary was asked how his drug pricing negotiations address insurance coverage for people like Richard, his response was that he is doing many, many things within the agency. He could not name a single tangible action that would help Richard pay that $1,700 bill. The power and control analysis of this testimony reveals a deliberate attempt to rebrand failure. Representative Horsford noted that the president is attempting to rebrand what he calls the one big, beautiful bill. This is an exercise in political marketing. The goal is to sell a product that the constituents are not buying because they are living the consequences of higher costs. The Secretary is using his power to control the narrative by using vague terms like many, many things instead of providing data. By telling the congressman to calm down, the Secretary attempted to use a tone of authority to silence a line of questioning about his own lack of preparation. This is a classic power move used when an official lacks the evidence to support their position. He tried to control the room because he could not control the facts.
EPA, Mr. Secretary, your department is not involved with rolling back protections that would increase exposure to heavy materials, even though it affects people's health? Is that what you're telling me? You don't coordinate?
I say, calm down, Congressman.
Don't tell me look, healthcare is personal to my constituents like Deja and Richard.
Is over.
Do not tell me to calm down. Healthcare is real. And if you can't answer basic questions, then maybe come prepared next time.
I'm answering the question. You don't give me the chance to answer. You haven't given me a chance to answer.
You said you
I'm happy
didn't
to answer your.
The strongest defense argument the Secretary attempted to mount was a pivot to technical reforms. He cited a reform on skin substitutes. He claimed this specific reform is reducing premiums in Medicare by 6% this year. This is his strongest defense because it uses a specific number in a specific medical category. However, this argument is easily dismantled using the law and the testimony itself. A 6% reduction in Medicare premiums for skin substitutes does nothing for a family like Richard's, whose marketplace premiums went up by $1,700. It does nothing for a child on Medicaid who needs a feeding tube to live. The Secretary is using a minor technicality to claim a broad victory. Furthermore, when asked if he had aligned his goals with the EPA to ensure these reforms actually make people healthier, he admitted he could not answer the question. A defense that relies on a 6% Medicare tweak while ignoring a $1,700 marketplace increase is not a defense. It is a distraction. We must understand the legal education of this role. The Secretary of Health and Human Services is legally responsible for the health of the public. This mandate does not exist in a vacuum. Public health is inextricably linked to environmental factors. Representative Horsford pointed out that the EPA is working to roll back protections that would increase exposure to heavy metals in drinking water. These include arsenic, lead, mercury, and chromium. These are toxins legally and scientifically linked to cancer, heart disease, stroke, and permanent brain damage in children. The law expects the head of the health department to coordinate with the EPA on these issues. However, the Secretary admitted on the record that he was not consulted on those efforts. He admitted his department is not involved in rolling back protections that increase exposure to heavy metals. This is a legal failure of interagency coordination. If you are the Secretary of Health and you are not involved when the government decides to let more lead into the water, you are not fulfilling the legal requirements of your office. This leads to a professional judgment on responsibility and fitness. The Secretary's performance demonstrated a profound lack of fitness for the complexities of the national healthcare system. He was unable to answer basic questions about bringing down costs and coverage. He admitted to a total lack of coordination with the EPA on toxins that cause brain damage. When a cabinet secretary says, "I haven't been consulted on the water supply," while claiming he wants to make America healthy, he is admitting to a fundamental incompetence. His inability to provide tangible actions and results for constituents like Deja and Richard proves he is not prepared for the job. He is a Secretary of Health who is disconnected from the health of the people. His professional judgment is flawed because he prioritizes political rebranding over the survival of the citizens he represents. The expert authority stack in this matter is provided by the people who live the results of these policies. Representative Horsford serves as the primary authority here, representing the House committee tasked with oversight, but the real experts are the mothers like Deja and the workers like Richard. They are the ones with the primary source data on what a healthcare cut looks like. They are the ones who know that premiums are not going down. The collective witness of the constituents proves that the Secretary is out of touch. Public sentiment, as reflected in the reactions to this testimony, shows a deep distrust. People are asking why a secretary would not know about Medicaid cuts that are written into the administration's own plans. They are asking why the room was empty during such a vital hearing. The authority of the office is being eroded by the incompetence of the officer. Institutional accountability must now fall to the courts and the halls of Congress. The Department of Justice and the relevant oversight committees have a responsibility to investigate the discrepancy between the secretary's testimony and the actual premium increases being reported. There is a failure of enforcement when a secretary can sit before a committee and claim no cuts exist while families are losing coverage. The Congressional Committee held a field hearing in Las Vegas where they reportedly shut out the public and brought in a paid actor. This is a failure of institutional transparency. The institutions designed to protect the public are instead being used to provide cover for a rebranding effort. Accountability requires a move beyond these field hearings and toward real enforcement of the HHS mandate to coordinate on environmental toxins. The procedural consequences of this testimony are clear. There will be no hope or hype here. The consequence of a secretary who does not coordinate with the EPA is that more lead and arsenic will remain in the drinking water. The consequence of a secretary who cannot explain rising premiums is that premiums will continue to rise. The procedure of the House will move forward with more hearings, but without a change in the secretary's level of preparation, the result will remain the same. Families will continue to be effectively out of the economy. Children will remain at risk of failing to thrive. The secretary's refusal to answer questions about tangible actions means that no tangible actions are currently being taken to protect the coverage of the American people. The process is stalled because the person at the top of the process does not have the answers. The evidence is in the transcript. The Secretary of Health and Human Services is either unaware of the cuts his administration is making, or he is willfully misrepresenting them to the public. He is failing to coordinate with the EPA on life-threatening toxins. He is unable to provide a single solution for a $1,700 premium hike. This is the state of your healthcare leadership. If you look at the trajectory of this department, the escalation of costs is matched only by the escalation of denial. When a mother explains that her child's survival depends on a program and the person in charge of that program denies its erosion, the social contract is broken. When a worker describes being priced out of the modern economy by health insurance premiums and the response is a discussion about skin substitutes in a different insurance pool, the policy has failed. We are witnessing a moment where the administrative state is prioritizing the optics of success over the mechanics of governance. The tension between the official record and the lived experience of the public has reached a breaking point. Every time a secretary fails to answer a direct question about a $1,700 increase, the instability of the system deepens. Every time an environmental toxin is ignored by the health department, the risk to the next generation increases. The narrative being presented by the department relies on the hope that the public will not read the transcripts. It relies on the assumption that the complexity of healthcare billing will mask the simplicity of the failure. But for people like Deja and Richard, the complexity is their daily reality. They do not need a briefing to know that their costs are rising. They do not need a policy paper to know that their access is shrinking. The failure of the secretary to acknowledge these facts is not a minor oversight. It is the core of the crisis. It represents a disconnect so profound that it calls into question the very purpose of the department. If the Department of Health and Human Services is not there to protect the vulnerable from cuts and toxins, then what is its function? If the secretary is not there to coordinate the defense of the public's health across all agencies, then why does the position exist? These are the questions that remain after the cameras are turned off and the hearing room is empty. The silence that follows the secretary's inability to provide answers is the most telling part of the testimony. It is a silence filled with the uncertainty of millions of families who are waiting for a leader who understands their struggle. The stakes could not be higher. We are talking about the water children drink and the medicine families need to survive. We are talking about the financial stability of the American household. When these pillars are threatened and the response is political rebranding, the consequence is a loss of faith in the institutions of government. This is the ultimate cost of the testimony we have reviewed. It is the cost of a mandate abandoned and a public trust betrayed. The path forward requires a level of transparency and competence that was not present in this hearing. It requires a secretary who is willing to look at the data provided by constituents and acknowledge the reality of the situation. It requires a department that works with the EPA instead of ignoring it. Until that happens, the tension between the government and the governed will continue to rise. The evidence is clear, the testimony is on the record, and the consequences are being felt in homes across the country. The question is no longer what the policy is, but whether the person in charge of the policy is capable of executing it. Based on the transcript, the answer is a matter of public concern that demands immediate attention and accountability. The final synthesis of this event leaves us with a binary conclusion. Either the Secretary does not understand the very system he is tasked with leading, or he is intentionally misrepresenting its impact on the American people. There is no middle ground when children's health and family finances are the variables. Before we close, one quick clarification. The content of this program is based on public information, official transcripts, and analysis of government proceedings. It is intended for educational and documentary purposes and is not a call to action or a substitute for professional legal or financial advice. We acknowledge that reasonable people can interpret the same facts and testimonies differently, and we encourage you to examine the primary sources for yourself. We invite you to join a thoughtful and respectful discussion in the comments below. If you found this analysis valuable and want to stay informed on the facts behind the headlines, please consider subscribing to the channel for more in-depth reporting.